This is a little bit like preaching to the choir when we talk about advocacy for malaria elimination in Asia Pacific, but looking around the room, it's a little bit more like preaching to the Pope, given the expertise gathered here. But I'm going to talk a little bit about our work at APLMA, and while I still have your attention, I'm going to talk a little bit about the Secretariat, but I'll need a bit of support putting the PowerPoint on the screen. So APLMA was formed, as Alan said, at the East Asia Summit in 2013, and we've actually been now successful in getting East Asia Summit statements on malaria elimination in the 2012, 2013, 2014, 2015, and 2016. The East Asia Summit is, as you know, an alliance of heads of government from the ASEAN states, plus the United States, Russia, Australia, and 6 others. And having that head of state commitment then gives us at the Secretariat the ability to go back to the member states, remind officers at a working level in Ministries of Finance, Foreign Affairs and Health what their commitment was, and follow up and try and create a sense of momentum and common cause. And each of those statements has moved the needle a little bit further. So the 2012 statement spoke of drug resistance, the 2013 established APLMA, then the elimination agreement, then a roadmap which has now been adopted by 20 heads of government across Asia Pacific. And we're now working to a dashboard inspired by the ALMA dashboard, thank you Joy, which is now being considered at a senior officials meeting every year. And the key thing about that senior officials meeting is that we bring together ministry representatives from finance and foreign affairs as well as health to discuss the progress towards elimination by 2030. And the progress so far has been pretty impressive. We've exceeded the 40% target already. In many of the countries in the region, we have seen a more than halving of the burden in cases and deaths. And in terms of our role in trying to build financial and political support for elimination, having a story like this to tell the ministers in the region is extremely important. The impact of this momentum has been really quite tangible. Since the 2030 goal was adopted by the East Asia Summit, we've seen India move to elimination for the first time, developing a national framework within 3 months of the EAS announcement by Prime Minister Modi. We've seen states in India now commit to quite ambitious targets around malaria elimination. We've seen increased domestic financing in the Philippines, Indonesia, Myanmar, Thailand. We have seen, of course, elimination in Sri Lanka last year. And we've seen an interesting increase in participation around other allied issues, such as innovation and drug regulation. My colleague, Dr. Jeff Clark, over here is managing a regional regulatory partnership with WHO, which brings together the heads of regulatory agencies from across the region to expedite the approval of new drugs and diagnostics across the region, which of course is a critical bottleneck towards elimination. So we have lots of good news, and we have a regional plan. So in addition to the global technical strategy, we also have the regional elimination roadmap, which is really a political document which heads of government have signed up to guide progress between now and 2030, and it comes with a range of priorities that inform the dashboard, and it's with that dashboard that we track progress every year and combine those data to feed them back to heads of government. We also have challenges, and many of you will be familiar with this graphic from WARN, which tracks the spread of drug-resistant malaria from SP and chloroquine previously, and we now have a real challenge in managing this emergency of drug resistance in the Greater Mekong sub-region, but also communicating that challenge. And I noted today a tweet that went out on our website where the Voice of America has just released a news article discussing this emergency and carefully juxtaposing the views of Professor Arjen Dorndorp, who many of you know, the National Malaria Program Manager in Cambodia, together with the World Health Organization and a receptionist on a bus conductor's counter in rural Cambodia. And they all, of course, are spinning different messages around drug resistance, and the need for us to carefully communicate this emergency, using it carefully for advocacy, is a real dance, and something that we've been involved in, certainly with the Australian government, who, as you know, at the weekend announced a $300 million health security fund, making sure that we're linking these challenges to a broader health security agenda whilst managing the public communication is very important. Now here you can see the diversity of the challenge that we have had despite the success, and these clocks here represent the differential burden between Vivax and falciparum. But you can see we're dealing with, from Afghanistan and Pakistan, with some very unique challenges, India, where we have a largely domestically financed burden where state-level decisions really define the response, and then down through Bangladesh, which has made very good progress, into the GMS, where we have this emergency of drug-resistant malaria. We have a new fund, as you know, $242 million announced by the Global Fund, mostly under catalytic funding, which is matched by a similar contribution through domestic financing. A very differential domestic financing environment there, where Thailand have increased, Myanmar have increased domestic financing, a number of challenges with, for example, the Cambodia program, and some solid progress being made in Vietnam and Laos. And then moving through Malaysia, where we have the challenge of Nolzai, into Indonesia, where we have a challenge, of course, in terms of the East, but also some good news, where a number of the governors in the East have now announced increased ambition in terms of malaria targets, but nevertheless the challenges of West Papua and, of course, Papua New Guinea and the Pacific relying on external financing, and our work with the Global Fund to keep the Global Fund global and make sure that the fund continues to invest in Asia and the Pacific, and continues particularly to look at countries in Melanesia which rely very heavily on external financing. Now, our job in communicating that challenge is made much easier by the progress we've seen in the Greater Mekong sub-region. Now, I've shown this graph to the Foreign Minister in Australia just on Sunday. Being able to communicate to a minister that, look, you had your Malaria 2012 conference here, you managed to co-invest 100 million together with another 100 million from the Global Fund in the Greater Mekong sub-region. The RAI has been very successful, and this is what the epidemiology is looking like. It's that elevator pitch that raises money. It actually isn't very detailed business cases and epidemiological studies. They underpin it, but it's the pitch to the decision makers that is key, and the more time I've spent with parliamentarians and politicians over the last 18 months, the more convinced I am that we need to really improve the quality of our communications. And one of the challenges we have with that, of course, is the nature of the bigger picture. Now, this is not to scale, but we have focused to date really communicating on the incremental successes we've had in the region and in the GMS. But of course, there is a much bigger success in that we have seen a consistent drop over the years, and it is this that we need to communicate. It's the counterfactual. It's the numbers of cases averted and lives saved that we need to communicate. And going forward, of course, finishing this job off, which is more expensive than anything we've tried to do before, but with marginally smaller gains on a per case or per death averted basis, means we need to be communicating this picture, the counterfactual, what would be happening, and indeed this picture, which is what will happen if the catalytic funding ends in 2020, if we don't continue to receive Global Fund support, and if our regional community is not successful in engaging with, for example, the multilateral and regional development banks in developing more finance. Now, there's good news here. The ADB and the Global Fund are working on a memorandum of understanding, which is very exciting. There's new money coming from Australia. Domestic financing is increasing in a number of countries, and APLMA, of course, are working with a range of partners on a country-by-country basis in priority markets. But the region is very, very diverse, and you can see here, if you look at the distribution of cases across the region, India is a huge challenge for the malaria community. The vast majority of cases, the vast majority of people at risk, up to 700 million people at risk, and financing decisions being made at a state level, requiring us to do advocacy at a state and sub-state level, very resource intensive and challenging. And then we, of course, have Indonesia, where we've seen increased domestic financing and some impressive progress. Myanmar, again, we've seen increased financing, but heavily reliant on external financing in Myanmar, and that will be a challenge right through probably for the next 10 years. And then the rest of the Greater Mekong sub-region, plus Malaysia, making up those last pieces there on the right. The other angle here, of course, is that these are the cases we estimate, but the range, if you look between confirmed cases, estimated cases, high and low, there is a very wide range, and particularly in India, for example, a great degree of uncertainty around what is the volume of the burden and therefore the resources that we need to tackle it. Good news on the financing in this region. We've seen a steady increase in financing, but as Dr. Cassette rightly said, a very heavy reliance on the Global Fund and really no guarantee that this support from the Global Fund will continue. Very important to be advocating to the Global Fund investors that the Global Fund stays global and that elimination becomes a priority for the Global Fund rather than just burden reduction, and particularly in the context of drug-resistant malaria. If the Global Fund exits from the GMS, I have absolutely no doubt we will see a devastating resurgence, and of course the risk of that resistance spreading to sub-Saharan Africa becomes far more likely if we see a resurgence. Final slide. The big picture in the regional health financing space is really extremely important. Whereas in sub-Saharan Africa we see a mix of domestic financing, Global Fund and bilateral financing likely to continue for many years, in this region we're seeing a rapid increase in social health insurance. We are seeing a rapid decline in external financing. And so you can see on this slide the blue line is total health expenditure, and all things being good, we will see a decline in out-of-pocket spending, which of course is regressive. We will see an increase in socially financed insurance products. The risk, of course, is that as external financing declines and domestic finance is increasingly put through social health insurance schemes, primary healthcare and preventative services fall off the radar. People are getting treatment for their NCDs in urban clinics through their social health insurance scheme, but there is no money going into prevention, into primary services, and into malaria most importantly in this context. So we have this potential Bermuda Triangle. These countries are transitioning, and they are transitioning too quickly, and the risk is that financing for malaria falls off the radar. And a big part of the work that we are doing is working with the multilateral development banks, with the ministries of finance, and with the regional development banks to try and show some leadership in this broader financing space and bringing that argument back to malaria, both because, of course, our core business is malaria, but also malaria is an excellent bellwether for access to preventative and primary care services for the rural poor. And that also is a passion of ours at APLMA, making the links between this bigger picture. So that's a quick overview of challenges and opportunities in the region. Happy to discuss more after this session, and thanks very much.